Namaskar everyone, I am Dr. Aratrika Shen and on this 31st May of World No Tobacco Day, I welcome you all in this special awareness podcast by Care for Community Initiative by North Bengal Medical College Alumni Association. World No Tobacco Day is celebrated across the globe to talk about the harmful effects of tobacco and encourage human beings to enjoy a harmless tobacco-free life. When we talk about tobacco, many people they think that I know it's harmful, but I cannot quit. What will I do? Well, as psychiatrists, we know that tobacco is not only just a habit, it's a dependence of the people around their mind, their emotion, the stress. People smoke to combat their daily stresses, daily life hassles, negative emotions, and thus they get dependent on the nicotine. But the most important thing that I want to share with you today, that quitting is possible. Quitting is not at all difficult. One can definitely quit tobacco with proper counseling, proper medication, determination, and motivation. Today, along with doctors of other specialties, we'll learn that what tobacco can do to our body, what damage can it do, and also we'll learn that how small behavioral changes can help us quitting the tobacco. Nicotine acts on our brain's reward system. Thus, when the brain does not get nicotine, there is craving, there is irritability, there is sadness, there is restlessness, and people again jump back to taking tobacco. Many users, they feel guilty about themselves that they have not tried to quit earlier. They have tried to quit, they have quitted, but again they have relapsed. But it's not about being ashamed. Remember, quitting is a process. It is not a single event. Now, let's learn from our head and neck oncology specialist that what devastating effects can tobacco have on our mouth and throat.
Do you know that 80 to 90% of cancers in India are related to tobacco? Tobacco in any form, smoking or chewing, may lead to 16 to 20 types of human cancers. Tobacco contains more than 70 carcinogens, that's cancer-causing chemicals. And these chemicals enter your body and slowly and silently work at a genetic level to change your own body's normal cells into cancer cells. And it's not only about you. Cancer is not selfish. As you smoke, your family and friends are also getting exposed to the similar harmful effects of tobacco, which we call second-hand smoking. And there is no safety limit. So, if you are a smoker or a tobacco chewer, stop immediately. And it's not about yourself, it's also about your loved ones. Thank you. Do you know?
Many patients say that they have tried to quit earlier, but they did not find the right support. They didn't know whom to approach. Remember, it's not a failure. Maybe that was not the time, but now it is the time. You can have the right support, you can have the right counseling, and definitely you can quit tobacco. Now let's learn from our oncology specialist that what different kinds of cancers can your body have when you are addicted to tobacco.
Like every year, 31st May we observe the World No Tobacco Day. We understand that smoking is injurious to health, smoking causes cancer, by which I mean smoking is dangerous for development of cancer of the mouth. Not only the smoking, use of tobacco in the form of pan, gutka, pankwara, khoini, etc. all leads to damage of the soft mucosal lining of our mouth. That leads to cancer of the lip, cancer of the buccal mucosa, alveolus, tongue, larynx, laryngopharynx, upper aerodigestive tract, etc. So use of tobacco in various forms is a very bad habit, and you must have to get rid of those bad habits. cancer, you understand, not occurs in single day. It takes time, sometimes for years, of using this type of smoking or tobacco chewing leads to cancer. So before development of the overt cancer, everybody will suffer in a stage which is called the pre-cancerous stage. So in this stage, if you regularly check up your mouth by some oncologist, then he or she will treat, and that treatment is not only helpful to you, but it is preventable from cancer. So cancer is a preventable disease when you have a leukoplakia or erythroplakia in your mouth, which can be curable permanently. So my suggestion is not to continue smoking, but to quit smoking immediately, and motivate your friends, your seniors and juniors to quit immediately from smoking and use of tobacco chewing. Thank you.
The first and foremost strategy to quit tobacco is fixing a quit date. That quit date, you will be informing all your family members, and they will remove all the tobacco and tobacco related products from your home, from your surroundings, and you will have a trusted friend or family member who can tackle your cravings. Now let's listen from our endocrinologist that what bad effects can tobacco have on our daily hormones.
So it is said that when you have one episode of heart attack, the chance of another episode, the second episode, increases 100 times. So when you already have diabetes, it is said that it is as if you already have one heart attack. So the chances of a coronary event, acute coronary event, is already 100 times more. Over on that, if the person smokes, the chances increase manifold. Not only of a myocardial infarction, that is heart attack, but also stroke, cerebrovascular disease, in which you may not die, but you are debilitated, and God knows for how many years you have to survive a pathetic life. Now when there is diabetes, if a diabetic patient smokes, the chances of the molecules which try to bring down the blood glucose levels, their effect decreases. The insulin resistance increases. As a result, the sugars usually are higher in the smoker population than their non-smoker diabetic counterparts. So, number one is insulin resistance. Number two, you will require higher medications, so higher cost. More so, higher chance of complications. I have already discussed the higher chances of heart attacks, strokes, but you need to remember there is also higher chances of peripheral vascular diseases which may lead to amputation of the lower extremities. So once your limbs are amputated, it's a very pathetic life. Take it from me. I have seen such patients. So having said that, if you are a diabetic patient, it is high time that you quit smoking. Thank you.
People often fear the withdrawal symptoms, but remember, they are temporary and they will pass, and obviously they are manageable with right medication and right behavioral changes. Now let's listen from our gynecologist specialist who will tell us about the effects of tobacco on infertility and other gynecological problems.
Today I will discuss about the effects of smoking and tobacco in young reproductive age group women and men. First we will discuss about the women's. Smoking adversely affects the chances of fertility in women. It damages the eggs. It increases the chances of miscarriage, preterm birth, low birth weight babies, and it also can cause birth defects in women. And in men, it adversely affects the sperm motility, sperm quality, and it reduces the sperm count. even it can cause erectile dysfunction. And the passive smoking is equally unhealthy for men and women of reproductive age group. So we can conclude from this that quitting smoking can improve fertility rate in women and men. Thank you.
Many parents quit tobacco when they found that tobacco is causing second-hand damage to their children. The emotional part is very important when a tobacco user is being counseled for quitting. Now let's listen from the ophthalmologist that what tobacco can do to our vision.
We all know that smoking causes a risk of vision. The major harm it causes is cataract. Smoking increases the risk of developing cataracts in early life. Cataracts cause the natural lens of the eye to become clouded. Age-related macular degeneration, it's called the AMD, and it is usually seen in older age groups. Smoking is one of the strongest risk factors for AMD, and that is a disease which affects the central vision of the retina, that's the macula, and it can cause difficulty in reading. Dry eye diseases, yes, that's a major factor. It irritates, smoke, it irritates the eye surface, reduces the quality, causing burning, redness, watering, gritty sensations. This is especially common in people with heavy screen use. That's a major drawback in our society these days. Next is very important, diabetic retinopathy. In people with diabetes, smoking worsens the blood vessels, damages the retina, increases the chance of diabetic eye disease progressing faster. Optic nerve damage. Yes, we all know the optic nerve is very important for our vision, and smoking reduces the oxygen supply to the optic nerves. This may contribute to optic neuropathy, permanent vision loss problems. Increased risk during eye surgery. Smoking definitely increases the risk in eye surgery. It heals very slow. The surgeries heal very slow after the
Now let me share few tips that can help you quitting tobacco. First of all, delay the urge. The craving usually go off within some minutes. Distract yourself. Walk, have some water, chew a sugar-free chewing gum, or call someone who can help you with talk. Deep breath. It will help you in reducing your anxiety symptoms. Avoid the situations that increase your tobacco consumption. You can easily identify the stresses which increases the tobacco consumption in you, and thus avoiding those stresses can always help in quitting tobacco. Reward yourself for every tobacco free day. Maybe a box of rasgulla, maybe one rasgulla. Reward yourself. Also remember, there are several effective medications that will help you in combating the withdrawal symptoms, like nicotine replacement therapy, nicotine patch, nicotine chewing gum, and there are also prescription drugs like varenicline, bupropion, which can be used under the supervision of a psychiatrist. On this World No Tobacco Day, remember, quitting tobacco is not only about disease, it is about regaining control over your life, your emotion. Help your parent, your children, your friend, your family member, your colleague to quit tobacco today. If you are trying to quit today, you are not alone. You have doctors, you have support groups, you have therapists, and you have your family members by your side. Quit today. Within 20 minutes of quitting tobacco, your body will begin to heal. This was a special community awareness program by the initiative Care for Community by North Bengal Medical College Alumni Association. Thank you for listening, and stay aware, stay healthy, and then only we will move together to a tobacco-free society. Thank you.